for Disease Control in the Thailand Ministry of Public Health.
Good afternoon. Sawadee ka. My name is Tharirat Chemnasiri, and today I'm going to talk about patterns of sex and PrEP in Bangkok MSM. In August 2013 and March 2014, we collected data from 38 Thai participants who joined the ADAPT study in Bangkok. We conducted 6 focus group discussions with 32 participants and additional 6 key informant interviews, 2 per study arm, after they completed 34 weeks of study follow-up. After that, we double-coded Thai transcript and analyzed the data. Grounded theory and content analysis were used to analyze the data in this study component. Among the total of 38 participants, the age range was 21 to 50 years old, and the median age was 30 years. 71% of participants were full-time employed, 86% completed college, and all of them reported never being married. We assessed patterns of sex in 3 different arms and pros and cons of each regimen. For the daily regimen, participants reported that this regimen worked well if they had this pattern of sex. Having frequent sex events, a preference not to plan for sex, having no control over planning for sex with sexual partners, and self-perceived of having high risk for HIV. There were pros and cons about this regimen, such as easy to take, as it can be taken with daily vitamins, and no need to plan for sex, no need to carry tablets, and no need to disclose about the PrEP use. But there were concerns about long-term impacts and side effects, and fears of being seen as being HIV-infected person. Some reported difficulty to use if they didn't have sex that much, and long-term tablet taking, routine change, tablet fatigue, and affordability were also reported. A participant said, "It would be awkward to take a tablet before or after sex. The sexual partner would ask what the tablet was for. But for daily dose, I could say it was dietary supplement, that's easy." And another one said, "I'm not at risk of getting HIV, and I don't do anything to make myself at risk. I don't even have sex. Why I need to take tablets daily?" Participants in the time-driven regimen reported that this regimen was optimal for this pattern of sex. Participants with infrequent sex events and ability to plan sex or having no control over planning for sex with sexual partners. The pros about this regimen were fewer doses, which meant less concern about side effects, ability to choose the day to take 2 tablets a week, and no need to plan for sex. They could keep few pills with them in the pocket, and then they're ready for the post-sex dose. On the other hand, the participants reported difficulty in linking routine activity with 2 tablet taking days, confusion about the regimen because it is quite complicated, the need to carry tablets and to hide them from others, and they noted that planning for sex made sex no longer enjoyable. A participant said, "My boyfriend always controls when to have sex, even though it is not often, so I continue to take tablets 2 days a week and just wait for the sex to happen." And another one said, "I don't plan for sex, I only carry tablets with me all the time." Participants in the event-driven regimen reported that this regimen worked well if participants had this pattern of sex, infrequent sex events, and ability to plan sex or having control over planning for sex with sexual partners. The pro about this regimen was fewer doses required. On the other hand, it was difficult for participants to plan for sex, to carry tablets, and to hide them from others. It was confusing to count the tablet taking time by the hour, and the regimen was complicated or difficult for them to follow. And the participant said, I always ask for sex from my boyfriend. Sometimes he says yes, sometimes he's tired. But if I'm really horny, I would take a tablet and get what I want. And another one said, after coming back from the bar, I took a tablet at 2 a.m. right before having sex, and I had to wait 2 hours to take post-sex dose at 4 a.m. I already fell asleep by then. In summary, participants report that the daily dose is the easiest regimen without ability of planning for sex, but there were concerns about long-term impacts and affordability. Candidates for non-daily dosing could include MSM, having infrequent sex event, capacity to plan for sex, and ability to take a post-sex dose. In conclusion, participants prefer to have different PrEP regimen options. Participants noted that regimen confusion was one of the barriers to PrEP adherence. Therefore, PrEP adherence counseling is needed for any PrEP users. And we need to give more information about PrEP to reduce stigma and foster more effective PrEP use. For more information, please visit our poster presentation on Wednesday. I would like to thank all funders and organizations above, especially our participants for their time and contribution. Thank you.